Welcome to the Health Resources Training Curriculum. As a preview, this video will cover standards of conduct, the scope of practice for nurse aides and direct service workers, reporting client condition change, and emergency management. Regarding standards of conduct, there are 4 main standards, and they are professionalism, communication, honesty, and confidentiality. As for professionalism, it includes behaving in a legal and ethical manner, maintaining a clean and neat appearance, dressing appropriately, being flexible and adaptive to change, having problem-solving skills, participating in continuing education, and having pride in your work. However, prohibited behaviors include acceptance of tips or gifts, personal calls, any unlawful harassment in violation of our policies prohibiting workplace such as violence, discrimination, or sexual behaviors, profanity, being under the influence that violates our substance abuse policy such as alcohol or drugs, and sleeping while on assignment. With the standard of communication, the requirements include properly documenting time slips, flow sheets, and progress notes, prepare and submit weekly paperwork to main office, notify staffing for any change in scheduling or availabilities, understand and follow the service plan when providing care for any client, and lastly, notify staffing or a nurse supervisor for any questions pertaining to the care of your client. Regarding honesty, it is expected to be trustworthy and have integrity. Anyone who is misappropriate or steals money, merchandise, and property will be prosecuted. Also, report any dishonest acts to your supervisor immediately. Failure to do so may result in disciplinary action. Furthermore, you are required to fully cooperate in any investigation of dishonesty. Dishonesty and failure to cooperate is an extremely serious misconduct and may result in disciplinary action up to and including discharge. As for confidentiality, always keep information about clients private and only disclose information to appropriate healthcare team members. Moving on to the scope of practice for nurse aides and direct service workers, the law requires that you do not perform certain tasks. Although you may feel qualified to do some of these tasks, you are limited to give care within your scope of practice. These tasks include never administer medication, never discuss a client's diagnosis or treatment, never diagnose a client, and never prescribe treatment or medication. As for reporting client condition change, notify your nurse supervisor and/or staffing department immediately for changes in client's condition or status to ensure timely and necessary follow-up. The types of condition or status changes to report are changes in behavior or mood such as agitation, depression, or confusion, new wound, bruises, or complaint of pain, loss of appetite, vomiting, diarrhea, or constipation, difficulty breathing or coughing up yellow or green sputum, and lastly, check individual service plan for specific changes to look for in your client. The notification procedure for immediate caregivers is to observe change and obtain an objective interpretation. Notify your nursing supervisor if you are not sure how to deal with client's condition change. Treat client's condition change only according to directions in service plan. Document change in client's condition, treatment, and notification in progress notes. And lastly, always notify staffing regarding client's condition change. As for emergency management, an emergency situation is an incident involving a client or worker that would not be considered routine. These actions would involve immediate intervention by someone other than the routine caregiver, agency, or facility involved with the client's case management. These types of situations include fires or traffic accidents, injuries that would not be considered as routine, natural disasters such as floods, hurricanes, or earthquakes, man-made disasters, harassment, physical or verbal attacks, power and/or telephone outage, death, and if the client client's whereabouts are unknown. With that said, this concludes the Health Resources Training Curriculum. Thank you.